Hi, my name is Cheryl. During the spring of 2012, at the age of 57, I was teaching fourth grade full-time, directing a musical with 50 kids after school, and teaching aerobic dance twice a week. In April, I started noticing a few twinges shooting up through my vaginal area, but did not think anything was wrong, just figured I'd pulled a muscle in an aerobics class. I kept noticing this throughout the spring and finally went to see my family doctor in late May. She did a pelvic exam and did not find anything, but said if it continued I should come back and they would do an ultrasound. I went to England in June for a couple of weeks to visit my daughter, and upon returning did not have any symptoms. However, by August I was noticing more twinges, a little bloating, and simply felt something was wrong. In early September, my doctor sent me to get a vaginal ultrasound. She called the same day to tell me they had found a cyst on each ovary. She made arrangements for me to meet a surgeon within 2 days, and my husband and I met with him, and he told me there was probably a 60% chance it would be ovarian cancer based on my age. I was scheduled for surgery 10 days later. He did a full hysterectomy and also removed most of my omentum, as it had cancer on it too, and a small spot on my bladder. I was diagnosed with stage 3C ovarian cancer. My doctor was extremely kind and very informative from day one with me and my family. He sat on my bed, held my hand, and very compassionately told me about my diagnosis. I was introduced to a navigating nurse who is still with me today that helped all of us work through this early process. My first thoughts upon finding out that I had cancer was, I had lived a very blessed life with wonderful daughters and a fantastic husband, and we would make it through this. After surgery and recovery, a port was put in, and I was scheduled for chemo in 3 weeks. I was supposed to get Taxol and carboplatin every week for 18 weeks, but I was extremely allergic to Taxol. So they switched to Taxotere, which I got every 3 weeks for 6 cycles. I prepared myself for this by cutting my long hair and eventually shaving it before I lost it all, stopped all teaching, and decided it was time to fight for my life. I got acupuncture 2 times a week right before infusion, and this seemed to help keep my blood counts up. I had reactions to the steroids with rashes and got sick, but for the most part I was able to tolerate chemo with the help of anti-nausea drugs, and soon learned the cyclical effects of the chemo, which included constipation, diarrhea, thrush in the mouth, and fatigue. After 3 months I had some redness with my port, and it got pretty irritated, so as soon as I was done with treatment they removed it. I finished the treatment in March and went back to teaching April 1st. I was assigned a new oncologist in May of 2013 as my first oncologist was moving away. I taught the entire school year, but it was very stressful and ended up retiring the following spring. I ended up having a hernia on my abdominal incision in the fall and had surgery with mesh put in it during my December school break. By August of 2014, I was having some twinges again, got a very bad yeast infection, was treated, but thought something was still wrong. So my doctor had me get a scan and biopsy, and they found the cancer was growing again, but very small and only in the abdominal cavity. A new port was put in, and I went through 6 cycles of Doxil and carboplatin. Did not lose my hair, taught aerobic dance, and directed a play throughout the treatment, and received acupuncture 2 times a week during this treatment. I was told at the end of the treatment that I held the record for tolerating the most carboplatin of any patient they had ever seen. The doctors were very positive that I would have a full remission at the end. That did not happen. Basically nothing happened. It did not grow, but it didn't shrink either. This was very difficult news for me, but at least the cancer was not growing. They did an estrogen receptor test on me, and it came back positive, so I was put on a drug that inhibited the production of estrogen. It was Arimidex. This was great news. We were all very excited this would work. My next scan in July showed no growth and with some decrease in tumor size, so it was very successful. This drug caused joint achiness, so I continued with acupuncture, which really helped with the pain, and I was introduced to Reiki at one of the cancer centers via my cancer navigating nurse. This turned out to be an incredible connection for me. I had Reiki done on me at least once a week. And Reiki is a Japanese art form that helps with healing and helps with just de-stressing people. And this really helped me. Acupuncture twice a week continued, massage once every 2 weeks, and I saw my chiropractor once a week. This was the new norm for me, and I continued this pattern until November of 2015, when we found out via a scan that the cancer was growing again. Very minimally, but still growing, so we had to come up with a new plan. At this time, I had a new oncologist again, a very outgoing young doctor who hugged me, was direct to me, and my husband was very supportive, and I was excited she'd taken over my care. She presented several options to me, and we decided I would start the drug Avastin, which blocks the blood supply to cancer tumors, every 2 weeks, and take a 50 milligram chemo pill of Cytoxan daily. I started this regimen in December, but was soon shifted to a 3-week dose in January due to blood pressure staying high and causing stress on me. This caused some serious issues with pain in my hands and feet, but we did not figure that out until late March. So at that time we went back to the 2-week dose and all was well again. I had scans every 3 months and they showed no growth, which is what we were hoping for. In early spring, we found out that my insurance was denying my coverage for Avastin, and it was reaching around $500,000. They were calling it experimental. My team went to work appealing this, however, we were still denied when we knew that other patients on the same regimen were being covered with other insurance carriers. So this was an added stress on me and my family. After 6 months of appeals, I was denied coverage. However, the drug company, Genentech, came through and is now covering the drug Avastin. As new physicians, please note that insurance coverage is very important to families in these situations. On September 8, 2016, my scan showed that the cancer was dead inside the tumors. This was more than we'd hoped for. I was considered to be in remission at this time. My oncologist and I both felt that me doing all of the extra support and staying very positive throughout this journey had helped me maintain a very high quality of life as I've traveled to various places in the world, continued to teach aerobics, direct plays and musicals, and truly enjoy life every day. In the spring of 2017, I ended up having a small growth again and had a biopsy and found out that my cancer had not changed in the least. It had not metastasized into any other place in my body. It's still contained in the abdominal cavity. I also ended up having a partial bowel obstruction at this time. I was put in the hospital for a few days, but it resolved itself very quickly, and I'm now on sort of a modified low-fiber diet to maintain that. Because I had a scan just a couple of weeks ago, and once again my cancer is stable and no growth, so we are staying the course with the Avastin and the Cytoxan. And so at this point, we're just waiting for things to continue as they have been with the drugs. I feel like after all of this, I'm pretty much a different person than who I was in 2012 when I started this journey with cancer. In many ways, I'm a better person. One is more patient, one who listens to life's little pleasures every day, and one who thinks that life on this earth is pretty great and a gift that we must appreciate. I could not have gotten through this without the love and support of my husband and 2 daughters and my health caregivers. As new doctors, the few words I want to say to you is listen to your patients, touch them, hug them, be there for them, as that helped me immensely. My oncologist and her team are there for me, and we often have group hugs in the office. They return my calls promptly, and no question is too dumb. They treat me like I'm a family member, and that is one of the most important things you can do. They encourage me to do Reiki, acupuncture, and massage. Healing is very tricky, and we know that the brain, the body, and the heart all have to work together to accomplish this. Thank you for listening to my story.